Hello friends, today we are going to discuss about schizophrenia. I am Dr. Suresh Badadmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Unit working at NIMANS, Bangalore. Before I start my presentation, I'd like to have a disclaimer. This presentation is for academic and training purpose only, not for professional clinical opinion or legal opinion. This is for training purpose only. Conflict of interest, none. Today we'll discuss about schizophrenia. The objective of this video is to understand what are the signs and symptoms of schizophrenia, how do you diagnose schizophrenia, prevalence of schizophrenia, treatment, duration of treatment, course and outcome of schizophrenia. So these are the important points we are going to discuss in this video. This video is meant for professionals, doctors, healthcare professionals, psychologists, social worker, nurses, persons with mental illness and their family members. Of course, for the policymakers and general population who want to help persons with mental illness. Schizophrenia is a thought disorder. There is abnormality in the thinking process of persons with schizophrenia. The Western literature says schizophrenia is a chronic condition. In contrary, in developing countries like India, schizophrenia has a good prognosis and the course is subacute in nature. It's not very chronic. 70% of them have good outcome. They're able to take medication. They're able to go back to work. And many people do not know they're suffering from schizophrenia because they're on medication doing well. Of course, schizophrenia occurs because of brain abnormalities. Not one abnormality. There are many multiple abnormalities which lead to schizophrenia. Schizophrenia is a treatable condition. Means there are various medications available currently in the market because of the advance in medical science. Of course, we are not able to pinpoint what is the one exact cause for schizophrenia because there are multiple causes which leads to schizophrenia. Coming to the signs and symptoms of schizophrenia, it is not very difficult to diagnose schizophrenia. Even an uneducated, illiterate is able to say, yes, this person has mental illness. The persons with schizophrenia has abnormal behavior, disorganized, they will be talking to self, they will be muttering to self, they will be smiling to self, they will be gesturing, they will be laughing to self also. Suspicious nature. They feel people are following them, they feel people are talking about them, they feel the whole world is prosecuting them, or else they also feel that they are persecuting them. They feel that police are following them. There is a trap laid out to kill them. They feel very fearful. They have unexplained behavior like setting fire, running away from home, not taking bath. Many a time, they cook their own food many a time thinking that the food is poisoned by their family members. Poor personal care. They do not take bath for many months. Not doing any work, unable to hold on to a job. At times, they become aggressive. These are the various signs and symptoms of schizophrenia. Prevalence. Of course, 0.3 to 0.7% of any population has schizophrenia. Is not only in India, across the world, the prevalence lasts from 0.3 to 0.7%. It translates, in India, we have 140 crore population. That means 40 to 100 lakh population has schizophrenia. Roughly, you can take 1 crore population has schizophrenia. How do we diagnose? There is no any lab test, no blood test, urine test, or any CT scan, MRI positively diagnoses schizophrenia. Schizophrenia is a clinical diagnosis. It is a syndrome. It's a cluster of symptoms which we call it as schizophrenia. Till date, we are not able to find a single laboratory test to diagnose schizophrenia. It is only by talking to the patient, getting a good history, doing a mental status examination, observing them, we make a diagnosis of schizophrenia. This is how the DSM-5, that is basically Diagnostic Statistical Manual of US, has come up with the diagnostic category. In 1 to 5, you see 1 is delusions, second is hallucinations, third is disorganized speech, fourth is grossly disorganized or catatonic behavior, fifth is negative symptoms. These are the 5 symptoms. First is delusions. Delusion is nothing but false fixed belief. Even if there is a contrary evidence is present, they continue to hold that belief. The family members do not believe in that thought, but still the person with that delusion will continue to hold on to that belief, telling that it is truth. It is beyond the person's social, cultural, and familial background. Just an example, delusion of persecution. The persons with schizophrenia will have delusion of persecution, thinking that family members are trying to kill them, neighbors are trying to kill them, the government is trying to kill them. They hold this belief very strong. The family members do not believe in this. Even though his socio-cultural background do not considers that he can be prosecuted or persecuted. But that is a delusion. Hallucinations. Second one. Here, the person will have hallucinations. That is basically, he will have false perception without any stimuli. That means for him, the perception will be real, but without any stimuli. Commonly is auditory hallucination. They will hear voices talking to them, speaking to them, commanding them, commenting about their behavior. The hallucinations are very disturbing. Third one is disorganized speech. The person, when he speaks, the other person will not be able to understand what he is speaking. So this 1, 2, 3, that is delusions, hallucination, disorganized speech, at least one symptom should be there for 1 month period, along with other 2. Disorganized behavior, catatonic behavior, and negative symptoms. Negative symptoms are basically the person will have poor socialization. He does not go out, has a poor emotional reactivity. We call it as apathy. Anhedonia, the person will not be able to enjoy any pleasurable activity. Alogia, he speaks very minimal. So these are called as negative symptoms. So if he has negative symptoms or else disorganized behavior, and in 1 to 3, one of the symptom, or at least 1 month period, along with dysfunction for 6 months, either in the biological function, social function, or occupational function. That means we can diagnose schizophrenia. So there are 2 important criteria. One is symptom criteria, which is there for at least for 1 month, and dysfunctional criteria for 6 months should be there. Then only we call it as schizophrenia. By chance, he may have symptom for 1 month period, but he recovered very fast within 2 months. He do not meet the criteria for 6 months of dysfunction. Then we call it as schizophreniform disorder. Or else, under international classification of disease, either 10 or 11, it is called as acute psychosis. This is how the diagnosis is done. Diagnosis is only clinical basis, not by lab basis. The clinical characteristics of schizophrenia. Usually the schizophrenia onset is between 20 to 24 years. That is, in the second decade, the person with schizophrenia will be stuck. This is the most important, crucial junction of any person's life. At the age of 20-24, he is at the corner period of his education to choose up his profession. He may not be able to compete with the normal world because of his mental illness and the ruthless competition. 1/3 of them will attempt suicide. 10% of the persons with schizophrenia complete suicide. At the same time, they are 5 times more violent than the normal population. And also, 10 to 15 years premature death is known in schizophrenia. Unemployment and burden adds to the problems of schizophrenia population. Coming to the etiology, how does schizophrenia occurs? There is not one cause has been identified. There are multiple causes have been identified. First and the foremost is biochemical, that is neurohormonal or neurochemicals in the brain abnormality, increased dopamine, abnormality in serotonin, and also various other biochemical abnormalities leads to schizophrenia. Genetic causes. Not one gene, there are multiple genes have been identified association with schizophrenia. Viral etiology has been found. That means the persons with mental illness would have had viral encephalitis or else in the womb or during the perinatal period, the mother would have had viral infection. Neurodevelopmental disorders have been considered. During the migration of neurons, when the brain development occurs, this abnormality in the neurodevelopmental can cause schizophrenia. Autoimmune diseases or immunologically imbalance can also cause schizophrenia. And various psychosocial theories, such as family theories, economic theory, sexual abuse, childhood trauma, various other theories have been put forward for schizophrenia. Hence, schizophrenia is considered as multifactorial, polygenetic brain illness. Very important is it's a brain illness. Coming to the treatment of schizophrenia, first and the foremost is antipsychotic medications. The reason being is the studies, especially in India, has clearly documented that just by providing medications continuously over a period of maybe 3 to 5 years, you can improve and reduce disability by 80%. So antipsychotic medication is the first line of treatment. Many a time, the persons with mental illness have violence or else suicidal behavior, at times homicidal behavior. Electroconvulsive therapy has found to be useful. Psychoeducation needs to be done to persons with mental illness and also to their family members. Of course, to the general population also. Family intervention and also rehabilitation. The rehabilitation, especially in developing countries like India, community-based rehabilitation has to be done, not the institution-based rehabilitation. Let's understand the duration of treatment. See, we understood the treatment process, but how long do we have to treat? This is one of the controversial topic which has been debated, discussed, and stigmatized by various people, both general population and many healthcare professionals, including doctors, debate about this treatment issues. First and the foremost, let's understand the x-axis as the time. You can see January, every 3 months we have put the milestone. If the person has mental illness from January, he developed mental illness, and the mental illness lasted at least for 4 months. That is January, February, March, April. At the end of the April, he is improving. He started improving, and then later he was in remission for next 9 months. The treatment was started somewhere during February. And now the treatment to stop the illness is called as therapeutic in nature. And continuing medication so that the illness does not recur is called as prophylaxis. It is as simple as if you understand epilepsy. First, you give medications, anti-epileptic, to stop epilepsy. That is called as therapeutic dosage. Once the epilepsy stops, you continue the medication for a period of 1 to 2 years more. That is called as prophylaxis. Similarly, the epilepsy being a brain disorder, even psychiatric illness is also because of brain illness. And there are multiple causes. Hence, the persons with mental illness, especially schizophrenia, requires therapeutic and also prophylaxis. The research have clearly found that the prophylaxis dosage and the therapeutic dosage are equal. That means what cures you, the same dosage should be continued during prophylaxis. Of course, each episode of mental illness for a period of 3 to 4 months, if an episode is there, the treatment will last for 6 to 9 months. After 6 to 9 months, the medication need to be tapered and stopped over a period of 2 to 3 months. So this is how the treatment occurs in schizophrenia, in one episode of schizophrenia. But however, the duration of treatment has been debated, and the duration of treatment is dependent on duration of illness. If a person comes after 5 years of illness, of course, the treatment also will be long. And it also depends upon the severity of illness. The longer the duration, severe the illness, then the longer will be the treatment. Number of episodes, number of relapses. If he has more number of episodes of illnesses, that means he need to take medication for longer duration. If he has number of relapses, he has to take medication for longer duration. If there is a family history of psychiatric illness, If it is father, mother, or a brother has similar illness or any other psychiatric illness, that means genetic loading is very high. Unlikely he will go into remission. He needs to be on treatment. At the same time, you need to discuss how long the medication has to be taken. This discussion needs to occur with the psychiatrist who is providing treatment. Of course, mental illness is not lifelong treatment. It depends upon the duration of illness, number of relapse, number of episodes, severity of illness, and family history of psychiatric illness. And you have to remember, mental illness is a brain abnormality related disorder. Hence, do not stop medication without your psychiatrist's opinion. If you stop medicine suddenly or abruptly, there is a possibility of rebound relapse can occur. Hence, the medicine need to be tapered and stopped. It is just like epilepsy or seizure disorder. The medicine need to be tapered and stopped. And also, the treatment requires prophylactic dosage. Before that, therapeutic medication has to be given to stop the illness and continue the medicine so that the illness does not relapse. Impact of treatment refusal. Persons with mental illness refuses treatment. This is the impact. The impact is mental illness continues, stigma continues, and discrimination continues. He will not be able to work. Since he is discriminated, he will not get a job. Because of mental illness, he can become violent. He may enter into conflict with law. He may be arrested. He may be in prison. He will be dependent on others for livelihood to survive. Homelessness and poverty is written if they don't take medications. And the research has clearly documented suicide and premature death. 10 to 15% of them commit suicide. Premature death, 10 to 15 years of their life is curtailed because of schizophrenia. Poor socialization, poor quality of life. They usually remain unmarried. Even if they are married, they get separated or divorced. Family burden is huge. Caregiver burden is huge. The caregivers suffer because of persons with mental illness, especially in developing world. The reason being is the government takes very less responsibility for providing care for persons with mental illness. Anyhow, family members are providing care for persons with mental illness, but they need to be enabled by caregivers' pension. That is very essential because community treatment is the only way to go for treatment with schizophrenia. Institutional care has been proved in the Western world costly, leads to human rights violation, leads to institutionalization, leads to high stigma and discrimination. Hence, community treatment, treatment with family members, treatment within their home, enabling the family members in provision of care is the only way to go forward in treatment of schizophrenia. The persons with schizophrenia need to be with the family. Hence, family members need to be empowered, supported, and treatment at the doorsteps, free medication, and pension to the caregiver and also for persons with schizophrenia need to be given. That is the only way to uphold the rights of persons with mental illness and also to see that Mental Health Care Act of 2017 is implemented. At the same time, the impact of refusing treatment leads to frequent relapse, long stay in the hospital, re-hospitalization, involuntary admission or supported admission, duration of spent in illness will be more, treatment non-responses. That means a person with schizophrenia comes to the hospital, medication is given, he responds well. Unfortunately, he will stop medication. And once he stops medication, he may not respond to the same medicine which he had responded earlier. He may require higher dosage or stronger medication. So, adherence and treatment response do not go hand in hand. Adherence, if there is a good compliance with medication, the medication will work. If there is a poor compliance with the medication, there is high possibility the same medication may not work in the next episode. Hence, good compliance is very, very essential. Reason for treatment refusal. We have discussed about the impact. Why persons with mental illness refuse medication? First and the foremost is denial of illness, telling that I'm normal, I don't have mental illness. Symptom profile. The person is highly paranoid. He feels people are trying to kill him. They are trying to drug him. They are trying to give medication forcibly. They are trying to put him in the hospital forcibly. So the paranoid ideas of the persons with mental illness creates the treatment refusal. Mood symptoms like feeling depressed or feeling paranoid, fearful, again they refuse medicine. They also worried about the side effects, especially sexual side effects, cognitive dulling, movement disorder. Many a time they feel that this medicine is weakening them or they are becoming dependent on this medication. Hence they want to refuse this medicine. Many a time longer duration of medication may also cause treatment refusal. Many a time these people with frequent relapse or many episodes of mental illness may require to take medications for years. Stigma and discrimination plays an important role. If I'm taking medication, what do the other people will think? What does my family member will think? What do my relatives and friends think? So that this stigma and discrimination makes them to stop medication. At the same time, access and cost of treatment. If there is no medication is available, even if the medication is available, it is not continuously made available. That leads to stop of medication. And also, nowadays, because of right-based legislation, right to refuse medication, it is the liberty of the persons with mental illness that he can refuse medicine. This is again creating a trouble because he will have relapse. But however, in rights-based medicine, rights-based legislation, the persons with mental illness has an opportunity whenever he becomes all right and when his capacity is restored, he can decide not to take medication. That is how the constitution of various countries do happen. At the same time, we need to increase compliance. How to increase the adherence of medication? Because the schizophrenia diagnosis is not an issue. The issue is compliance. Issue is supply of medication. The issue is access to treatment. So how do we improve that? Psychoeducation for persons with mental illness, family members, and the community. Supervised medication. Medicine should be given by the family member on everyday basis. Choose safer medications with lesser side effect. It may be costly, but that is the only way to go forward. Make sure these medicines are made available free of cost at their doorsteps. Involving in treatment decision making. If the person with mental illness or schizophrenia is involved, definitely they will take medication. If there is a possibility of relapse, consider long-acting parenteral injections. Frequent follow-ups. Once a month follow-up can consider. The research have shown that frequent follow-ups will lead to good compliance. Monitor the blood levels of medications. Sometimes there are persons with mental illness, because of the poor insight, they stop medicine very often, they become violent, especially with the family members. In such a scenario, AOT or LCTO is very essential. Assisted outpatient treatment or community treatment order given by the judiciary so that the family members become empowered. The family member knows if he stops medicine, he will relapse. But because he has mental capacity, he will refuse medication. In such a scenario, AOT and CTO plays a very essential role. And CTO has been found to be useful in US, in many European countries also. Yes, it needs to be weighed in the context of our country, where persons with mental illness are treated within the community by the family members. I think there is a scope to enable the family members with community treatment order so that the judiciary issues the order and the police implements it. If persons with mental illness refuses medication, the family members can approach police and the police need to help the family members based on the CTO. Yes, there is a scope, but it needs to be explored. This is my personal opinion regarding AOT and CTO. Coming to the case manager, which is there in again developed countries, like social worker, nurses need to visit home and provide care at doorstep, providing medication, providing injections, checking whether the various social welfare measures are there, disability certificate, whether their rights are violated, the property issues, domestic violence, free legal aid. Those are the issues need to be discussed at home. Medication reminder applications are coming very often nowadays in handy in the mobile phone. Those need to be considered to increase the compliance. Course and outcome. Coming to the last part of my presentation. Although the Western literature says the course of schizophrenia is chronic and very few people improve. But in developing countries like India, the course is benign and outcome is very good. Let's see some of the important study. First and the foremost is 25 years Madras longitudinal study done by Dr. Tara from SCARF. They clearly showed that there is complete recovery up to 15%, no relapse 8%, and one or more relapse up to 30%. And incomplete remissions are there. Totally, they said 70% do well on medications. It's a very important finding after 25 years. But however, they also noted some disturbing facts. 25% had died and 20% were dropped out. They were not traceable. But however, the course and prognosis, they said 70% they do well. This study is available in Indian Journal of Psychiatry, published in 2012. And this is one of the 25-year follow-up study. Another important study is 4-year prospective follow-up study. They followed up every 2 months. This is done by Community Psychiatry Unit of NIMHANS. This was done in community, especially in Turvekere and Tirthalli population. They had 200 and odd psychiatric patients, especially schizophrenia patient, and they followed them for up to 4 years. This is how the results have been shown. Again, their report is also, you can find 70% of them are doing well. That means it has a very good outcome. The course is also very benign when compared to Western population. And at the same time, they also said that death was 8%, dropout was 15%. In general, we can say 70% of the population do well. Again, this study has been published in Indian Journal of Medical Research in 2017. This is one of the finest study of catchment of schizophrenia patient in a rural population, not in a psychiatric institution. This study was conducted in a taluka place, in a community sample. Summarizing the course and outcome, 30 to 40% of schizophrenia patient will have only one episode. They will remit. They will take treatment for 6 to 9 months and they're completely all right. Unfortunately, these are the population who do not come outside and say that I had schizophrenia, I have taken treatment, I'm completely remitted. Since they do not come out and say, the stigma continues. These are the people who need to come out and say schizophrenia is curable, treatable, and I can lead a normal life. I can hold a job. I've seen many schizophrenia patients who are recovered, holding administrative post, being healthcare professionals like doctors, or maybe even police or in judiciary. And many of them even are holding political position also. So unfortunately, they are worried about stigma and discrimination, and they do not even acknowledge they had mental illness. These are the population, around 30 to 40%. They have one episode around 3 to 4 months in their life, and rest, they are completely fine in their life. The second group, 30 to 40% will have 2 or 3 episodes of relapse, and they continue to do well. That means 70% of the population, they do well. There is another 10 to 20%. They have continuous illness with in-between exacerbations whenever the medications are discontinued, but they have some stable deficits. But we can say that they may not be able to hold a job, but on medication, they're able to have good activities of daily living. They'll be able to take care of themselves, but they may not be able to earn their livelihood, look after the families. So this is around 20%. Last 10%, they have a downhill course. They have a severe illness in spite of any good medication and by treating even by an excellent psychiatrist and a good medications. They may not improve at all, in spite of the best treatment available in the world. They have a very bad prognosis. They are around 10%. Many a time they require institutional care. For this, the government need to provide institutional care. Family members becomes devastated when the treatment doesn't improve or the treatment doesn't give any yield. That means if the patient is continuously ill for 4 to 5 years, imagine the plight of the family members. Hence, this is a situation where the government need to step in, provide institutional care, maybe supported accommodation, sheltered accommodation, even rehabilitation center, halfway home, providing caregivers pension play a major role. But however, how do we predict the course and outcome of schizophrenia? What are those factors which says this person will do well, this person will have poor prognosis? Let's discuss that. The onset. If it is acute, they have a very good prognosis. Slow onset or insidious onset has a bad prognosis. If the age at onset is early, that means if the onset is before 20 years, they have a poor prognosis. If the treatment is started early, and if the treatment is started delayed treatment has poor prognosis. If there is a poor compliance for medication, poor prognosis. If the duration of illness is very long, that means the prognosis that treatment is also long, improvement is also guarded. Substance use, comorbid. If a person with schizophrenia is using alcohol, tobacco, drugs, if it is there, the prognosis will be very bad. If there are negative symptoms like alogia, that means he speaks very less, apathy, asocialization, prognosis is very poor. If the stressor is present during the onset of illness, it has a good prognosis. If there is no stressor is present, that means the prognosis is poor. Family support, if it is good, the possibility of prognosis is good. Premorbid personality is well adjusted, the prognosis is good. Family history of mental illness, if it is present, has a poor prognosis. If no other family members have mental illness, then the prognosis is good. Cognitive deficits, if it is there, that means the prognosis is bad. Obstetric complications during the birth of the persons with mental illness or schizophrenia, if they have obstetric complication, again, the outcome is poor. Structural brain abnormalities, especially if you see neurodevelopmental disorders, islands of the brain tissues, if it is seen in the white matter, that means islands of gray matter in the white matter is seen, that means it has a poor prognosis. Presence of tardive dyskinesia, again, a poor prognostic indicator. To conclude, my dear friends, schizophrenia is a chronic medical condition. It is a brain disease. It is because of multifactorial and polygenetic in nature. Early diagnosis and good treatment definitely has a good prognosis. Ensure adherence. The person needs to take medication for longer durations. Prophylaxis is mandatory. Supervised medication is required. And do remember, schizophrenia is a treatable condition. Dare to care, because persons with schizophrenia is a treatable condition. They are human. They are entitled for protection and access to mental health care under the Mental Health Care Act of 2017. Thank you very much for giving your valuable time. Stay safe.